Hi, this is Matt and welcome to my channel where we bring you medical news from reputable resources. Today's video is about a recent study from Weill Cornell Medicine. We will talk about their recent research and what they found. Strokes. Stroke is and has long been a leading cause of mortality and long-term disability worldwide. The vast majority of strokes are ischemic strokes involving a blood clot in a vessel serving the brain. The blockage or severe reduction of blood flow reduces oxygen and nutrient delivery to downstream brain cells, killing or injuring them and triggering inflammatory processes that can cause further damage. Strokes cause numerous changes in gene activity in affected small blood vessels in the brain, and these changes are potentially targetable with existing or future drugs to mitigate brain injury or improve stroke recovery, according to a study led by Weill Cornell Medicine scientists. The research. In the study, which appeared on April 14, 2023, the researchers performed a comprehensive survey in a preclinical model of gene activity changes in small blood vessels in the brain following stroke. Comparing these changes to those that have been recorded in stroke patients, they catalogued hundreds of genes with significant stroke-driven changes and likely relevance in human strokes. Our findings provide a knowledge base that improves our understanding of strokes and points to specific molecules and pathways that can now be investigated as potential targets for future stroke treatments, said study senior author Dr. Teresa Sanchez. It is also increasingly recognized that vascular disease is associated with and contributes to cognitive dysfunction and dementia. This study has identified molecular features associated with vascular dysfunction in the human brain after stroke, a major cause of dementia. The small cerebral blood vessels downstream of the blockage are also affected, and the changes in them are thought to contribute further to brain damage post-stroke. Yet these microvascular changes have been technically challenging to record accurately, and thus have not been as well studied as other aspects of stroke, nor do they have any specific treatment. We found that following stroke, some molecules that would weaken the blood-brain barrier were upregulated, while others that should protect the blood-brain barrier were downregulated, said Dr. Sanchez. This is consistent with clinical observations of blood-brain barrier disruptions following stroke. The analysis also identified the disruption of normal activity in genes controlling the level of sphingolipids. These fat-related molecules are heavily involved in regulating blood vessels, and disruptions of their normal workings have been observed in stroke, atherosclerosis, and vascular dementia. The team discovered that some types of these sphingolipids are highly enriched in cerebral blood vessels compared with brain tissue. In addition, they identified alterations in these sphingolipids in the cerebral microvasculature induced by stroke, as well as the changes in key molecules that control the level of these lipids. What was found in the study? These new findings will permit the pharmacological targeting of these pathways for stroke therapeutic discovery. The study included assessments confirming the druggability or suitability for targeting with small molecule drugs of many of the molecules with altered production post-stroke. Indeed, some of the identified molecules are already being targeted by candidate drugs to treat other pathological conditions, which could facilitate the repurposing of these drugs for the treatment of stroke and dementia. Dr. Sanchez and her team are now following up with preclinical experiments using candidate drugs or genetic methods to reverse some of the specific microvascular changes identified in their study, to investigate if this could be beneficial for stroke patients. We've generated this knowledge platform and we're using it, but we also hope that other scientists will join us in these efforts to develop the first therapies targeting the microvasculature in stroke, she said. We hope you found this video insightful. You can share your thoughts in the comments below. Don't forget to subscribe. See you next time.